everyone, I'm Erin Jackson and I'm a speech language pathologist at Therapy Care. Today I'm talking about signs of language delays in older school-aged kids. I know the majority of information out there is geared towards preschool-aged kids and how to identify language disorders early on. However, there are older kids that slip through the cracks and may end up needing services later on when some of their deficits become more apparent as their school curriculum and the need to form more complex social relationships becomes more demanding. So I'm going to talk about some of the big signs that parents and teachers can look out for and help identify those kids that could benefit from increased intervention from a speech pathologist. So when it comes to this area of our profession, I realize it's less known and talked about. It's a common misconception that speech pathologists only work with little preschoolers learning to talk, or they just teach kids how to correctly say their R's and S's. But the scope of speech language pathologists stretches much further than that, and we work with kids and adults of all ages on anything related to communication, cognitive function, and also feeding and swallowing. So because of this misconception, parents sometimes don't even consider speech language therapy as an option for their 7-year-old or their 13 or 16-year-old who might be struggling academically or socially. So I'm going to list several signs that could indicate a language impairment in an older child. Many people with language impairments have difficulty learning to read. So this includes decoding words and using phonological awareness, so their ability to sound out words, segmenting words, and identifying rhyming words. It also includes comprehending what they read, so answering questions about something that they read and being able to summarize. Along those same lines, they might have difficulty with spelling as well. Another sign is that they might have trouble describing events and sequencing parts of a story that they're telling. They can have difficulty forming complete sentences and using correct grammar. They might have word-finding difficulties, which may cause them to use filler words excessively, like or while they formulate their thoughts. They may have difficulty initiating and maintaining conversations with others, or they have trouble taking turns in conversation, or even trouble staying on topic. They might have difficulty relating to other kids their age, or their interactions with others can seem unusual or inappropriate. They might have trouble understanding figurative language, like it's raining cats and dogs, for example. Or they might have difficulty with identifying synonyms and opposites, also having difficulty following directions. So all of those things that I just listed are areas that can be targeted in speech therapy. It's important for parents and teachers to identify these needs and refer to specialists as appropriate, in this case to a speech pathologist. I hope this information is helpful and maybe you learned something new. Thank you so much for listening.